So hello, welcome. My name is Michelle Smith, and I am the with the Interior Center for the BC Support Unit. Every time I say that, I stumble. I don't know why. A couple notes to start. You are in the afternoon session of the Centering Lived Experience and Equity in a Program of Research, 2:30 to 3:30. We can use the chat box. We will monitor that for questions. And then the panel has left some time at the end also for questions. And at that, I will move it forward to the panel to start.
Great. Good afternoon, everybody, or good morning, I guess evening, depending on where you are. Thanks for joining us today. My name is Saraswati Vedam, and I am the principal of the Birthplace Lab. And we're going to tell you a little bit today about the research that we do at the Birthplace Lab and what we've learned in our process of doing participatory action research. Before we get started, however, I would like to introduce you to our one of our dear colleagues, Rachel Olson. She's a Indigenous researcher working with our lab and is also the director and president of the Firelight Group, which is an Indigenous research organization. She holds a PhD in social anthropology from the University of Sussex in the UK. And her research is focused on Indigenous midwifery and the relocation of birth for Indigenous women in Manitoba, Canada. She's an honorary member of the National Aboriginal Council of Midwives. And we've really valued working with Rachel, as she's a co-PI on a project that we're doing around decolonizing birth research. And you'll hear more about that today. So I asked Rachel to do our acknowledgement of the land and blessing.
Great, thank you. Thanks, everyone. I'm really happy to be here today, and thank you for asking me to open the session. I don't normally do this, so I'm a little tiny bit nervous, but I know what to say, so I'll just say it. My name is Rachel Olson. I am a citizen of the Trondequichin Nation from the North Yukon territory. I'm a member of the Wolf Clan in the Yukon. Everything goes through the matrilineal line, so that's my clan, is the Wolf Clan. My husband is Anishinaabe from Manitoba, and his family has also gifted me a First Nations name, which I've been practicing in Anishinaabe, but I'll say it in English. It's the leader of the Thunderbirds, so I'm very happy to carry that name and to be given it. I'm also a sun dancer, and so I am very lucky and very happy to share that ceremony with my husband's family and my community in Manitoba. So thank you. Today I just wanted to open by saying thanks for everyone to come here, and we want to acknowledge all of the traditional territories we all find ourselves on. Currently, I am in my house, and I live on the Tsleil-Waututh Reserve in North Vancouver, British Columbia. So I just want to say thank you for allowing us to live and work and play on these Indigenous lands and near the water and all of these kinds of things. And I know that we're all over the place, so if we could just take a minute to acknowledge where we are and be thankful for that, that's everything. Thank you very much, Saras.
Thank you. Thank you. I'm sitting in my home, which is very close to the Musqueam Nations, and I'm grateful to be a guest on this land. And I'm going to share my screen now, and I'll say how we're going to. It is a panel presentation, and then several of our team members are here to speak with you and speak with each other about these ideas. I'm going to start and open with a few slides to just give you kind of the context of our conversation, and then we're going to come off the slides, and I'll introduce you to the team. They're going to have a conversation about, we had lots of conversations leading up to today to say, what's the most important things that we have learned in doing this type of research, and what can we pass on that might be helpful. And so we will have that conversation. Then I will come back to some slides when we talk about how we tell the stories, and kind of summarize it. And then I will try and leave some time at the end of the hour, before the end of the hour, so that we can have an open discussion. If we're not such a big group, it'd be great to hear from all of you. So just bear with me while I share my screen here. So I'm just going to go back to the front here. Okay, so what we want to talk about today, you'll all be able to see my screen. Allison, can you give me a thumbs up if you can see it, since I can see you? Great. All right, so we felt that when we talked about participatory research and what we do at the Birthplace Lab, that this concept of centering the lived experience and expertise of the service users that we work with to do this research was kind of the most important, and the thing that we most wanted to talk about, that we've learned about and keep learning about. Our lab does a person-centered outcomes research on high quality care and the experience of care across a variety of childbearing families. And most of our research has been centered on North America, although we are engaged in some global projects as well. Our research, we're grateful to have had funding from a number of different sources, and they support mostly the infrastructure that allows us to do this work. And I think that what we're talking about, and really what this whole conference is talking about, is how do we ask the right questions in the right way. In traditional research, we definitely, people are very focused on, have we asked enough people? But what we want to center on is, have we asked the right people? And have we asked the right people, and are we asking those questions in the right way? And that's what we're going to talk about today. There is some larger discussion in the academic literature about this. In The Lancet published an article in 2018, and then discussed it, the authors, 2014, and discussed in 2018, that 90% of research dollars in our field in maternity care goes into the first line management of complications, even though that is 10% or less of people who experience those things. So it's a huge amount of dollar and energy going into just medical complications, and this entire rest of the area of understanding, we don't have a lot of data on. We don't have a lot of data on how we should best organize care. How do values and respect and communication or relationships impact care and quality of care? What about the different philosophies that we bring to our research that influence whether or not we are looking at optimizing biological and psychological outcomes as opposed to looking at adverse outcomes? So, education, assessment, screening, there are many things that we don't have enough attention to. So we are in our lab, we are really in this wheelhouse. What we're going to talk to you about today is based on a number of different studies. A couple of them have we completed, and you can see we had large data sets. One was province-wide here in BC, and another was in the US. It was national with all 50 states participating, and with a deliberate sampling strategy through participatory research for looking at the outcomes, experience of care and outcomes among communities of color and those who chose community birth. Currently, we're engaged in a national study called the RESPECT study, which you're going to hear more about today. We have a sister project called Decolonizing Birth Research, which is, both of those projects are focused on understanding the experience of exceptional, kind, supportive care, as well as mistreatment, disrespect, and abuse that can happen during pregnancy or childbirth. And we're trying to center the voices of people who are often not heard. So we have a focus on BIPOC communities, immigrants, refugees, people who live in rural, remote settings, people who have housing instability, or live with challenging circumstances like substance use, disabilities, things like that. So we have another project which is very focused on the LGBTQ two-spirited families, and that's just getting going. In all of our studies, and we mostly have done, we've done some mixed methods work, surveys and focus groups, so we get both quantitative and qualitative data. But in every one of those projects, we start even before we start the project, we create a team. We're going to hear about steering councils, things like that, and they help us seek the funding, decide what to study, how to study it, how to collect the data, how to interpret the findings, and how to tell the story. Also, who needs to hear the story. Our panelists and team members are here with us today, and they are Rachel Olson, who's, as you've met, the director of the Firelight Research Group, Ariane Metalis, who is from Quebec and not unable to be with us today, unfortunately, because she's ill. Muriel Scott is with us from Cross Lake in Manitoba. Carolina Wenzel, who has been with our projects for a long time, and she'll tell you a little bit about that. Right now, she is a regional recruitment coordinator for BC and Northwest Territories in the Yukon. Allison McLean is one of the community engagement coordinators at the Birthplace Lab. Winnie Lowe is another community engagement coordinator. I'm going to actually properly introduce them before they speak, so you can actually see their faces and not my slides. Laura Beer is our research coordinator, and Jeanette McCulloch helps us with all of our communication needs, everything from our website to our knowledge translation tools. We do have several other members of our internal team, as well as lots of collaborators, and I've listed some of them for you who have helped us to prepare this presentation, and we really value their contributions, though they aren't able to be with us today. I'm going to pause here shortly, and we're going to start our conversation. We're going to start with a discussion about trust and why trust is important, and also how we've learned the different methods that we've used through our survey research and through our community engagement and forming of our teams about how to build trust. And then we will move into talking more about the actual process of, say, conducting a survey, or some tools that you can use and methods that help to increase participation of community members in designing the study. And you can see some of those roles that they can play. And then we're going to wrap it up with talking about how you tell those stories, also in partnership with communities. So I think we'll start. Rachel, if you could start us off, that would be great.
Sure, thank you. So to start thinking about this concept of trust, I really thought about sort of the title of our panel, and I'll just say that for this project, I am co-leading one of the projects, the Decolonizing Birth Research Method. So a lot of what I'm saying comes from sort of my experience with that, and I really look forward to hearing everyone else on the panel talk about all of the other great work that has been going on with the Birthplace Lab. And so when I was thinking about centering lived expertise and equity, throughout a program of research, I really started to think about my experiences with the Birthplace Lab in terms of all of these different sort of centers where during the research process within the research program. So the main one was, the internal research team, and sort of how we thought about how we're composed, how we conduct our meetings, and all of those things. So sort of those internal, inward-looking processes. And then thinking about the development of relationships with the communities or our community partners and the people that we want to be conducting research with, and how that gets approached. And then also further from that is, the external engagement with the research community, such as, a panel presentation like this, and the process that we go through in order to come to a place where we get to talk to people about these things. And I really see all of these multiple sort of overlapping centers of different sort of focuses. And I think what really is important is that, you know, throughout all of the work that we're doing is that we're aligning all of these centers together with the lens of looking at, you know, prioritizing lived expertise and equity in the work that we're doing. And I think this really is something that I've experienced since I've been working with the lab, is that it really requires a lot of intentional work and action throughout every step of the process. And I think that that intentional work really builds this foundation of trust amongst team members, trust with the community, and also, you know, producing really high quality research that contributes to knowledge in our field. A couple of things that I was also thinking about in terms of lived expertise and equity from my perspective in a sort of a decolonizing lens is one of positionality as an Indigenous researcher. And I'll digress a little bit into my own story, but as an Indigenous person studying anthropology, when I started off in my master's degree, I got a lot of comments and pushback that because I was a member of the community that I was working with, that was really, it was seen as a deficit to me, that I wouldn't be able to have that critical distance from the research in order to truly sort of analyze and come up with my conclusions in my research process. And then as I, you know, as time went on, when I started my PhD, under the direction of Dr. Maya Unithan at the University of Sussex, she actually refused to take me on as a PhD student until she understood that I did have that lived expertise and that I had that knowledge of the community, and that was a critical piece of that would be a critical piece of my success as a researcher, is to have that lived experience and that knowledge throughout my work. So I think that shift, and I see that this work is a continuation of that shift to respecting and understanding the role of lived expertise within research. And I'll just say two more things. I really love the words lived expertise. I think they're amazing. And, because I really think that it really conveys how honoring and respecting lived experience and knowledge becomes critical to research and research processes, in that it makes it authoritative, and it makes it a kind of knowledge that can make decisions in research processes. It can manage risks, and it can really guide the production of knowledge. And so the concept of asking the right questions to get the right answers to really get us to where we want to go in terms of the kind of change we are trying to affect with the work that we're doing. And I think the inclusion of lived expertise is also one that allows us to have emotional engagement with the process and with the topics, and to actually have sort of a socio-physiological engagement almost with the research, especially when we're dealing with subjects like birth and racism and respect and all of these kinds of things. And I really believe that that even though back at the beginning of my master's, that might have been seen as a weakness, but I really feel that it's a critical part of successful research processes. And so I'm really looking forward to hearing all of the different examples and ways in which these topics have come into the research that's being done at the Birthplace Lab. And I just want to say thank you for letting me be a part of it. Masicho.
Thank you. Thank you, Rachel. Allison, I think you are going to help us understand some of these concepts before we move into kind of the actual methods.
Yeah, so thank you, Rachel, for those. Those are really insightful and interesting pieces that you added, so I'm glad to have been here. When it comes to trust, for me, I'm coming at it from the perspective of a Black woman. I'm a refugee, so an immigrant as well. And also working in academia, you kind of see most research teams do not look, super diverse or consist of the communities that are often studied. And that's something that I think, right away for these communities makes people not trust the researchers, because if the researchers don't look like me and they're coming into my community, how can I be sure that they have the interests of my community at heart, or that they even understand what, the interests or the best things for my community are? And so I think some research teams will employ the whole picking people from the community to do maybe the recruiting or the data collection or things like that. And that's what a lot of things do, a lot of teams do. And that's something that has caused harm. And I think when you talk about trust building in research, that's something that cannot be skipped. The relational harms that have come to Indigenous communities, Black communities, other racialized communities, marginalized communities from participating in research. And these harms have varied, obviously, quite a bit, depending on the study and what was done. But I think it's always important as researchers or people going into different communities to think about that when going into the communities, and also realizing that building trust takes time. So with funders, they have a timeline, they have deliverables that they want you to have at different time points. But I think if you're really centering lived experience and lived expertise, these have to be adjusted and a decolonized approach has to be taken, because building trust is going to take time, and there has to be place and time allowed for this process, because it may not be pretty. It might take a really long time, but it's just something that has to happen for there to be meaningful engagement that doesn't cause harm to the community. And I think also researchers do benefit when they have meaningful relationships with the communities in which they are working and in which they want to, I think we all want to think research or research teams go in to help, right? So if you really want to help, I think investing that time so that you do, bring the most benefit to the community, but you also learn a lot as well through that process, I think is important. And then last thing I will discuss is transparency and accountability. So transparency when it comes to everything, the structure of the team. So if let's say you're sending someone to, a Black community who's Black, and thinking that will bridge trust with the community, but that person doesn't actually have a say in anything that happens in the study. So even if the community says, oh, hey, we don't think this will work, or can you change this, or we don't like this, or this doesn't make sense to us, or this is not beneficial to us. If that person that you're sending as the representative to get in to that community doesn't actually have any power, it becomes pretty apparent quickly. So I think just being transparent about the structure and hierarchies within your research team and how everyone is interconnected and the power dynamics, and having just honest conversations, even about funding and about anything that may come up about data sharing, about data managing, who owns the data, how will the data be analyzed? Because I think sometimes researchers, and I want to say it's not intentional, right? But might not always know exactly how they will interpret the data when it comes to the end, or sometimes they know how they want to interpret it, but because it will affect your study if you tell the community that, hey, we want to interpret it this way, some of those things are not shared in a transparent way with communities. So I think just having open communication and full transparency throughout all processes that are involved in research, I think is a good thing to do. And also being accountable. So if you do cause harm, or if the community feels you're not listening to them, instead of blaming it on one person or saying, well, we didn't get that feedback. So let's say the PI says, well, I didn't know about that. The other people didn't tell me. That is not being accountable, because to that community, anyone who is showing up representing your team is part of your team, and they have power and they are external. So to them, they don't necessarily care that you know, maybe that person didn't tell you because to them, they said it to someone who is part of the team. So I think even if there are those breakdowns within the team, just having that accountability to say, we should have followed up with this, or we will look into this. Oh, you know what? We're sorry. We caused harm here. How can we repair this and move forward? How can we reconcile this relationship? How can we do better now or do better next time? Just, I think, having taking accountability for harms, that can be caused and are often caused through research is integral to this type of work as well.
Thank you, Allison. I wonder if you could just, as we segue into talking, I'm going to have Carolina tell us and Muriel about their roles, and I can see Laura wants to say something, but I wonder if you can take what you said and give that concrete example of one thing like the steering council, the formation of the steering council, and what we set up, how often we met with them, or the regional recruitment coordinators. You can just describe for the participants what that looks like when in our respect study.
Okay, so a specific respect study example when it comes to all of these things that I mentioned. For the respect study, we are looking at many different groups. So LGBTQ2SIA+, we are looking at visible minorities. We're looking at recent immigrants and refugees. We're looking at any people with substance use issues or any people who have a history of incarceration. We're looking at people with disabilities who have been pregnant or given birth in Canada in the past 10 years. So as you can imagine, these are very diverse groups. So we sought out steering council members that were from as many of the groups as possible. And if I remember correctly, I think we were able to get at least one person from each of these groups I just mentioned. And as we were conducting study activities, so for example, with developing the survey, we would send super specific questions and then also probing questions, so things that we were trying to decide as a team, because I think there's a balance between overwhelming steering committees with every single decision and not asking for enough input. So as we were looking for the items for the survey, we compiled a large database. I think the first batch of questions we had it was in the thousands. We just had so many, but we didn't want to make the decisions of which questions should stay, because even if I use myself as an example, I'm a Black woman, I'm a refugee, even with ticking these two buckets, there's going to be things that I might think, oh, this would never happen in Canada, just because I don't have, those lenses where it would happen to me. So just, I think having in your scope, starting like by casting a wide net and including everyone at every single stage, and even in things that, as a team, you feel, okay, I think most people will say this, or I think most people will agree to this. We would always just put everything to the steering council, and all the feedback that they gave us, we would compile it all into one document and then group it by similarities. So if it was, these are all comments on question 1, these are all comments about language, these are all comments about representation, we would group all of these and then look at them, and we actioned every single one. So at the next meeting or at the next iteration of the survey questions, the steering council members would see that, oh, wow, that feedback that we gave was incorporated. And we would also start off by letting people know how it was incorporated and showing, those documents where we've grouped all similar comments together and just outlining, okay, so for this question, most people said this, a few people said this, so this is what we did, and then if at that meeting, some people were like, yeah, but I think we can still do more, with this question, then we did that. So it was never unilateral decisions by any one person on the team or even the team. And by team, I just mean the research core team that everyone is used to. But I think all things were done with the steering committee. So all big decisions and little decisions, to be honest, were all done together. And I think that helped build trust for them. And we were transparent about the process. We were accountable. If anyone missed a meeting and said, oh, you know, I missed the last meeting or two, and I don't understand how we went from this to this, we were able to show, whether it's meeting minutes plus, you know, all the other documents that we had showing how we had gone through the different processes. And we were always super open with anyone who reached out wanting to, you know, have these discussions. There was never, well, we've decided and that's what the team's going, you know, forward with, without any room to discuss and explain how these decisions came about. I hope I kind of.
Yes, thank you, Allison. I think that's a great segue into what Carolina could tell us. I want to introduce you to Carolina Wenzel, who is a mom of two and has previous experience with working in research and working with adults with disabilities. And Carolina will tell you a little bit about how she got drafted into this work. But she's been part of our Birthplace Lab work for a number of years and in a number of different roles. And I think it'll be helpful for you to hear her perspective about some of the things that Allison said, since she is currently on the Steering Council for the Respect study, and also a regional recruitment coordinator for the Yukon, Northwest Territory, and Northern BC communities. Carolina, go ahead. Tell us, you know, as someone coming with lived experience and whose role has evolved across the course of the study, how did you become involved and what has the process been like for you?
Okay, thanks, Saras. Yeah, so my name is Carolina Wenzel, and like mentioned, I have two children. They're now almost 5 and 2. And as you can see by looking at me, I don't fall into one of the minorities that the Respect study is targeting. So I'm a white, cisgendered woman with European background. I am, I guess, an immigrant, but I was one, so I feel pretty Canadian. But what I sort of bring into the study and where my lived experience has been sort of centered, and the focus that I've brought now that I'm involved has been the rural aspect. So living rurally with a lack of access to certain types of care during pregnancy and birth is also a focus of the study. And so for me, it was the case that for both my pregnancy, I was living in the Yukon, and I did not have access to the type of maternity care that I wanted and desired that was in alignment with the values that my husband and I held as a family. So we were hoping to have midwifery care during our pregnancy, and in the Yukon, midwifery is not regulated. And where we were, which was outside of Dawson City, so quite far north, there was not even access to an unregulated midwife, and in fact, no access to giving birth in the community that we lived in either, because although there is a hospital, the hospital does not provide birthing. So everyone in that community has to travel at least 500 kilometers to access a hospital. And so for us, we felt strongly about the type of care that we wanted. We felt like it made a huge difference, or would make a difference, and retrospectively it did, in the experiences for us and for our children coming into this world. And so it caused a lot of stress that we weren't able to access the type of care we wanted. And in the end, we did a lot of traveling. So we did have both our children in Vancouver, and we had our children with the UBC midwives, Birth and Beyond Clinic out of UBC. And so I have that firsthand experience of not being able to access the care I want, having to travel, having that financial hardship, not being covered for healthcare in BC since we were Yukon citizens, so not being covered for midwifery, even though it is covered in BC, all that sort of thing. It all worked out well for us in the end. We had great experiences, and I'm very happy that we were able and had the capacity to seek out what we needed. That's not always the case for everyone, with not as much privilege as was the case for us. And so basically, after the experiences we had with the UBC midwives, and when this research started out, I was approached and asked if I wanted to be involved. And I immediately said yes, because having gone through birthing twice, and I felt like it was such an important part of many people's lives, and the way we come into this world is so key. And so I've been part of the steering council since 2019, early 2019. And just a few words maybe I'd like to say to that process. So like Allison was mentioning, we would have meetings like this, because we're all over Canada. And I can sort of vouch for the truly participatory and bottom up way that the research has been handled through respect. And we would truly be involved. We were involved in everything, whether it came down to sort of the broader questions of what themes do we look at, what is important to us. And like Alison mentioned, I was representing rural people. There was people from every sort of group that we were trying to engage with, bringing in their feedback. And that got taken into account and came back to us. We felt that. And then then it came down to like the wording of questions. Is this how we want to word it? Is this going to trigger somebody? Is this not clear? And so we were very involved in that. And even other things, the name, the respect name, the logo. We tinkered with that for a long time. Did that speak to everyone on the council? And changes were made. Suggestions were presented, and then we had another discussion on it. So that was a really, really amazing experience. And I felt I have some experience in research previously, and I feel like I have a bit of an understanding over the past 2 decades how that has shifted, and I'm positively happy with how things are happening like this in a truly participatory rather than sort of token participatory way. And so after having been involved in the steering council for over a year, almost a year and a half, I jumped at the opportunity to be able to step into the Birthplace Lab team in a more active role, or an even more active role, I guess, with recruitment. So now I'm a regional recruitment coordinator for the Yukon, the Northwest Territories, and Northern BC. And I can really feel confident that when I'm going out there trying to recruit participants, I really can tell them the questions we're asking, they were designed, literally, they were worded by people like you who have lived it, who can tell us what's important to ask, how we should ask, how we shouldn't ask, and that it's going to have, hopefully, but I think all the best structures in place for it to have a real impact on the ground. And so that's what I'm doing now with the team, and it's been a really awesome journey. So thanks to everyone, and I'm glad I could sort of give my 2 cents.
Thank you, Carolina. Muriel, do you have anything to add to that? I don't know if you're able to put your camera on it, or if you can hear me, Muriel. Muriel Scott is the research program manager in First Nations Health Social Secretariat of Manitoba in Cross Lake. And she has extensive experience in research in her community and working with organizations like the University of Manitoba and University of Winnipeg on other projects. And she's known as the best data collector in Manitoba, and came highly recommended to us. She collected data on over 1,000 surveys in Manitoba in a previous project. So I asked her if she would come. We also had Ariane from Quebec. We wanted to show you some of that representativeness. So Muriel, perhaps you can talk to the group and tell them about the meetings that you've been attending. What your thoughts?
Hi everyone. Pretty nervous here. My first time being on Zoom, and with this new technology in my community, I've been proud of myself that I can do it, and it's very good opportunity for me to be working with you guys. It's an excellent work what you guys have been doing. You guys are so amazing with the new technology, with showing me how to do this stuff, and it's very you guys are very hard workers, and I'm very proud of being here and to you guys. And and I trust you guys with with what I'm gonna be doing for you guys. And using my language is a big thing in my community. Using our own language and doing interviews, and by for me to be talking to a person in my own language, interpreting that that what is to be shared of among each other as an Aboriginal people. You have to talk, agree, and get that over there for them to understand it, and for me to understand it as well, for him to do the research thing. Maybe I'm not making sense, or something like that. Anyway, well, to use that language in our own community and to have that respect and honoring each other members that are willing to do a research or what that um, survey that they're willing to do, that I can use it in my own language, that to interpret it to them, for a better understanding. And
Maybe, Muriel, you could tell them about our recent conversation about with the connectivity and what the solution we came up with as far as how you could take the survey to people who are in your community.
oh yeah, they'll be sending an iPad to my community for me to for the people to do the survey in our community. It's an excellent experience. I've never had that done, so I'm willing to learn that part too.
That means that these with the survey tool that we use, it can live on the iPad. Muriel can work with her community to fill it out and upload their answers when she gets back to connectivity, so they don't have to have connectivity, so that we can collect that data in the same way. So thank you, Muriel. And please feel free to interrupt and add. Carolina, do you want to say something more?
I just wanted to add, because Muriel was mentioning language, and I don't know if it's been mentioned yet. So I wanted to mention to everyone who's listening and who isn't familiar with Respect Study, that the survey, when we were working on the questions, or the main language in the team was English, but they have since been translated, those questions. And so I'm sure Alison or someone could give you the exact list. I have sort of half of it in my head, but it's not only English and French, which is sort of our typical, but we have Inuktitut, and we have, Mandarin and Punjabi,
Cantonese, Arabic, Spanish. Yeah, it's in eight different languages. And we did that looking at the communities and what might make these complex concepts like respect and disrespect and interactions be easier to talk about. Okay, I'm watching the time here. It goes fast. I'd like to hear a little bit. Laura, maybe you could say something about the research environment and administrative things that go alongside this. And then I'd like to hear, we can tell you a little bit more about the, some of the Delphi process and things that other processes that we use to help create that sense of being consulted. And then we'll move to Jeanette. Go ahead, Laura.
Sure. Yeah, I'll very briefly touch on it because, as I said, the time's trucking on. But yeah, kind of touching on what Alison and Rachel were discussing at the early stages. As the research coordinator in the lab, I'm very kind of deep in the administrative side of the research. And so I think just one thing to kind of point out as well with this is, as Rachel was saying, in talking about being really intentional in what we do, we really have to build these projects and participation, participant, what's the word I'm looking for? Patient-oriented research, sorry. We really need to build from the ground up. So when we are looking at building kind of the budgets and things for funding agencies, a lot of this research isn't classically what funders fund or do or understand. Same with the university and the processes. So we do have to be intentional with making sure that we build those budgets, and what we're asking for really honors the work that we're trying to do, that we're really asking for budget to support the time it really takes to build the trust and the relationships with these communities, which means that we can really effectively do this work, and we can really make sure that we're honoring the process and the people, and doing it well and with intention. And I think just one thing that kind of highlights that, once we go through the granting agencies, once we hopefully get people that are excited about this work like we are and fund it, we then have the university level to contend with, whereby again a lot of the processes set up at university level aren't necessarily in line with some of this work. So we have to be inventive, we have to challenge the university sometimes on the processes in which they do things. And with Rachel and the Decolonizing Birth Research Project, we had this with things like finances, and Rachel as a co-lead on the project, there was budget built in, that was going to be moved to Firelight, and we really wanted to make sure that we were intentional with how we moved that money and those kind of things. And with Firelight being a community-based research organization as opposed to a university, that kind of threw the university somewhat, and they were hoping for us to pay her as a contractor and various other things, which really wasn't in keeping with the work that we were doing and the partnership that we have with Rachel as a co-lead. So it took some time, it took some work to have the university come on board with us and get a process in place by which we could transfer those funds. But I think it's just important to kind of highlight that sometimes, this work is so important, and sometimes the processes that are currently in place aren't set up necessarily to work with us. So, but there are ways to do it. We just have to challenge it and really work inventively to do it justice. I think that's just worth pointing.
Winnie, would you like to say something quickly about the Delphi process? I think it'd be good for the everybody to hear about what we did when we were trying to identify, to get that input.
Yes, I think most of the other processes have been covered by all the other team members. So I'm going to dive straight into the survey development part, which we use Delphi process. And for those who are not familiar with Delphi process, it is a method that we use to gather a group of panel of experts. And these experts actually include our community partners. So people we really value, who has lived experience from, different background, as mentioned before, the BIPOC community, LGBTQ community, people living in rural areas, people have disability, and so on and so forth, and other circumstances. So we have this group of people working together, including researchers with, different expertise, healthcare professional, as well as community-based organization, on a big team, having regular meetings. And there are a lot of communication in between. What we started out doing was to basically, we had previous study in relation to respect study. So I'm speaking on respect study, but other research study before is on the same focus as well. So we use some of those questions to share with this group of experts, to ask them whether we should include in the survey, this national survey for Canada. And we had gone through that process back and forth, and that's been some exclusion, inclusion as well. And then they were also advising us on what theme that's important, in particularly from their lived experience as well as their community. And again, a lot of communication going on, challenges, because everyone lived across Canada at different time zone. I think that's one of the challenges I wanted to bring in as well. And of course, we think, just as we think we have covered most of the things, we have a few, community members will come and say, hey, I think you missed these sort of questions or topics. So we will have to include that as well. So we work with them, and basically at the end of the Delphi process, we collected all the feedbacks. They are quantitative as well as qualitative feedbacks. We analyze and then share with them. And the second round, we again consult them by emails as well as meetings and finalizing on the items, the question that we wanted to focus on. So at the end, we have a general consensus, and very luckily, we managed to have a final survey, which was early in this year, which we actually take it out to a new group of people who's our new community partners. They are our pilot testers. We recruited 60 people who have never actually seen the surveys before, from, again, a broader background, circumstances, and identity. And they actually, again, input a lot of valuable perspective that some might have overlooked before. I have to give you an example here because at the start of the survey development, we did think about different kind of disability, people with disability. We have people on board with sensory disability, but mainly physical disability. And during the pilot testing part, we have worked with someone who has been blind from birth, and her experience in doing research have led us to develop a special screen version for our study as well. So not just the 7 languages that we have gone back and forth with our community members, we have an additional screen version as well, which we're, as a whole team, we're very, very proud of. So that's all I wanted to say about the Delphi process and the development and the pilot testing. And other processes, of course, mentioned before were the naming and branding. That took actually a few months, but I think, we had received a lot of feedback also from Carolina, who's just spoken with you, and from other commission members, that even down to the name and the logo, they were consulted, and the feedback we got was very positive. So that just highlight is very, very important, that the lived experience is, individual lived experience is extremely important.
Thank you, Winnie. So I'll just, before I turn it over to Jeanette, I will just mention that the Delphi process is a formal process. There's lots published on it for studying or creating a consensus on something that hasn't been well understood or described, or people are measuring in many different ways. So one of the components that's important is that the feedback is collected anonymously, so that there's no power differential between whether or not that person is a clinician researcher or a service user or somebody who is, from the community or is has an agenda. So they all, give their feedback anonymously. And the second thing I wanted to say is that with our regional recruitment coordinators, and we don't have time to go into all of the as we also recruited people to do the recruitment from these different communities, we try to provide lots and lots of supports for them with training materials, a website, a place, a Facebook group that they could share information on, the communication tools, also training materials around equity approaches to engaging in ethics and things like that. So that was all done deliberately, and also took, as everybody has said, more time, and they were paid for that engagement. So Jeanette, I'm going to turn it over to you to help spend a few minutes telling us about how we tell the stories. I'll bring up your slides.
Oh, thank you. Thank you, Saras, and thank you so much all for this panel. That we've centered the patient experience or the community experience when the community members involved in the study have already so eloquently shared really the key points that are needed here, right? Which is, I loved what you said, Muriel, and I want to elevate that again, which is you talked about how much it meant for you to hear, for you to be able to share the work in your own voice, right? And that's really what both our dissemination strategy has been about, and also about telling the story. And Carolina, you did a lovely job of speaking about how we engaged folks in the process of every last little detail of the logo. And I just want to draw people's attention to the fact that this was viewed through the lens of ability rights, of gender equity, of ensuring that it didn't represent one specific race or ethnicity, but that a number of different folks could see themselves in this logo. Next slide, please. One of the ways, and we've been talking about the concept of trust, and of course the concept of trust extends throughout the recruitment process. And again, one of the ways that we've been engaging is to provide the materials that Carolina and Muriel have been speaking about, that speak directly to the target audiences of the survey, because we all know that there are certain audiences that are going to easily complete a survey, but there are others that, because of longstanding trust issues that Allison raised earlier, the ways in which we reach out help to build trust, and that we have been working closely with the RRCs in order to develop those materials. Next slide. And you already spoke, Saras, a little bit to some of the strategies that we've used to bring together the RRCs and to share strategies and approaches. So we'll just skip over this to the next part. I think the one thing we haven't had an opportunity to talk much about today is that, of course, there's the incredible work of developing the survey and recruiting folks for research. But then what happens next? Of course, it's of incredible importance that when we are engaging with the community around research, that we ask the question of, okay, we have these findings. Now, what findings are most important for you to be expressed, and how can we put those together in a way that are helpful to you? And so another one of our team members has done some incredible work around reaching out to community to say, what are the most important parts of the research that you want to see shared, and how would you like it shared? And then we took those ideas and we translated them. So here's an example from a previous study where what we did was take the information, translate it into consumer-friendly or service user-friendly social media graphics. And despite the fact that the lab, has a growing but relatively small social media audience, this had huge traction in which we heard, in which it was shared, over 1,000 times. It reached, more than 20,000 folks just with the social media, with just these 3 social media graphics. There were lots of other ways in which we were reaching audiences through press release that led to any number of pieces of media coverage. But part of what was really important to us was not just that we were putting out the findings, but that we're creating an opportunity to engage with the findings. And what emerged were some really challenging but important conversations in which people shared some different stories, which Saras is sharing these here. And I wanted to read one that isn't here, because before I handed it over to Saras, I did want to end on a positive story that had been shared. As we have been circulating the RESPECT study, although we did not solicit folks sharing their stories on social media, they have in fact chosen to do so. And I just thought this story was so powerful. It's a mom who said, I had the best midwife for all 3 kids. At my first ultrasound at 18 weeks, they found soft markers for Down syndrome. We were sent for additional testing where it was confirmed that our firstborn had T21. My midwife was a complete rock and was so supportive through the entire process. When my son was born, he was also diagnosed with Hirschsprung's disease and was in the NICU for 3 weeks. Even though we were being followed by a pediatrician at this point, my midwife still checked on us and kept on us for an extra week before discharging us. So, or kept us on, I think is what she meant. So the research has the dissemination of the research has not only provided a space for folks to hear this information, but also to engage with it and to start larger conversations that we of course hope get picked up for all kinds of purposes, like for folks to share their stories, for advocacy. And with that, I'll turn it over to you, Saras.
Thanks. I'm sorry that we've sort of run out of our time, but you can go on our website and see a lot of these things. And I do want to put this last slide up while we, see if there's anything, that we really need to address from the audience. I do hope the Respect study is still active. It launched in July, and for those of you who are here, we really hope that you will share it through your networks as well, so that we get lots and lots of participation for people telling us about the whole range of their experiences. So thanks. Emily or Michelle, is anybody with the chat? I haven't been able to monitor the chat while I'm going here, and I know we're out of time, but I'm, we're happy to stay if there are questions or desire to.
So far, I haven't seen any chats to the larger group. Is there any quick questions or anything anyone would like to ask before we move over, or you can follow up later?
Yeah, you can always reach us. It's at thebirthplacelab.org.
Can you please share the link on more info for the formal
validated that formal process? Yeah, so we have several different formal processes that we've used for content validation, as well as the Delphi process, and those are going to be out in manuscripts soon. They're in draft now, so we'll certainly share that.
Excellent. So we're now jumping to 3:30. Thank you so much. I don't actually want it to end because it's very it's great.
There's a lot to say.
It resonates. Yeah. Yes, we need a whole day for you. Yes, thank you so much.
Thank you.
And I hope we hear more from you soon, and hope everyone has a chance to follow up.
Great. Thanks,
the
everybody.
Links.
And will this are you recording the sessions, Michelle?
Yes, Emily will know better, but they are being recorded, the presentation piece. Yeah.
Will they share that back with us so that we can show
yes, everything's been recorded.
Everything's
been recorded and will be shared.
Wonderful. Thank you so much.
Well, thank you. That was a wonderful presentation.
And now onward to the final plenary session, patient-oriented research and health technology. Well, we'll see you there.
Thank you, Muriel. Michael, put your camera on. Let's say hello to you. Michael Rose has just joined our team today. So, and must be quite jet lagged because he's arrived just yesterday from Switzerland. But thank you for joining us and welcome. You've now been introduced to our team, or at least many of our team. All right. Have a good day. Good evening, everybody. Thanks, everybody. You guys rock.
Thank you.
That was great.